Hi there, I'm Dr. Grant Blashki. Welcome to FamilyDoctor.expert. Today we're going to talk about measles. Historically, measles has been a terrible illness causing much sickness and deaths among children for many years until we discovered the vaccine. And in the developed countries with the vaccine, we've had measles under very good control, but in recent years we're seeing a resurgence of measles, mainly due to people choosing not to do the vaccination, and we'll talk a bit about that. And this is insane. In my opinion, I think that having the measles vaccine is very worthwhile. What is measles? Well, it's a virus, and it has other names. It's also called morbili, and it's also called Rubeola, not to be confused with Rubella, which is German measles, which is a different disease. So generally what happens is usually a child, but anyone, gets sick with some classic symptoms. They have 4 days of at least of high fever over 38 degrees. They have what we call the 3 C's, a cough, conjunctivitis, red eyes, and coryza, which is just a fancy way of saying a head cold, so a runny nose, etc. And classically, there are what are called Koplik spots. Not everyone gets these, but if the doctor sees these in the mouth, they say for sure this is measles, so the doctor always wants to have a look in the mouth. And then of course you develop a rash that starts on the face and goes on the whole body. It's called what we call a macular papular rash, which is sort of a red, blotchy, bumpy rash. So one of the problems with measles is there can be complications. So most kids with measles are going to be fine, probably 5 days in bed, probably a couple of weeks where they actually have to be not going to school so that they don't contact other kids, and no big deal, and it's finished. But there are significant rates of complications, pneumonia, diarrhea and vomiting, ear infections, can get in the eye and cause scarring, corneal scarring, can get in the brain and cause encephalitis, or a very nasty brain complication, which is very rare, fortunately, called SSPE, which fortunately I have never seen and is very rare. There are some fatalities associated with measles, especially in underdeveloped countries with poverty-stricken or undernourished kids. There are quite significant rates of fatality, over 20-30%, so very serious. In the developed countries, fatalities are much less common, maybe 2 or 3 in 1,000. So we're going to take measles seriously. If the doctor thinks that someone has measles, they'll organise a blood test. They look for antibodies to measles, what we call the IgM antibodies. Sometimes these aren't positive in the first 3 days, and they might want to repeat the blood test if it's negative to check if the person has antibodies. Importantly, if the person's recently been vaccinated for measles in the last sort of between 1 and 8 weeks, the blood test is not very helpful. So your doctor will think about these issues. Now, how is it transmitted? Measles is extremely catchy. If you've been around someone with measles, there's a 9 in 10 chance that you'll get it. So it's a real issue for public health doctors to try and contain the outbreaks. So it's spread by respiratory droplets or with direct contact with any of the secretions from the nose or the throat. And the virus actually can last in the environment for about 2 hours. So if someone's had measles and they've been in a room, we keep that room clear for at least 2 hours. Now, when is it infectious? Unfortunately, people are infectious before they get the rash. So 5 days before from the rash onset, they're already infectious until at least 4 days after the rash. They can still be infectious. So this is important for stopping outbreaks occurring. So let's talk a little bit about getting vaccinated against this terrible disease. For someone that's had measles, they already have immunity, and generally the doctor will want to double check that with a blood test, because sometimes people think they've had measles and they haven't. But most people who haven't had measles, very important to have vaccination. Vaccination at 12 months of age will give antibody protection to 95% of those who are vaccinated. If you have another vaccine at 4 years of age, you get 99% protection against the disease. So that's pretty good. In Australia, often the measles vaccine is given with some other vaccines, one called MMR, which is measles, mumps, rubella, or another one called MMRV, which is measles, mumps, rubella, and varicella, which is actually the chickenpox one. So the typical schedule in Australia anyway is the first vaccine, the MMR, is given at 1 year, and a second MMRV with the chickenpox given at 18 months. If the kid doesn't get the 18-month vaccine, they can still have another MMR at age 4. So the details of this you can discuss with your doctor, but I think vaccination is very worth having. Now, what about if we get an outbreak? Obviously, if we have a case of measles, we've got to exclude that person at least for 4 days. We have to immunise the contacts of that person. Now, there's a few rules around that which your doctor will work out, but basically, if it's within the last 72 hours, your doctor will give you a vaccination. If it's between 4 and 7 days, the doctor will give you immunoglobulin, which is a bit different to the vaccination. It's like a passive vaccine. And there's special rules as to what to do with under 1-year-olds who've been in contact with measles. So I'd recommend you talk to your doctor about that and see if the child should have the vaccine or the immunoglobulin or what to do. In terms of treatment, there's not lots we can do. It's fluids, paracetamol, isolation. If the child has complications, bacterial infections, those sort of things, antibiotics might be an issue. If they're very sick, they might need to go into hospital. So I need to make a bit of a comment about the vaccination, which I think is absolutely important. And I must say all my kids have been vaccinated. There are some risks of the vaccine, although people who promote anti-vaccination will tend to exaggerate them. But you can get a fever, you can get irritability, a small number of kids will get a faint rash a couple of weeks after the vaccine. But these are all minor complications and compare really very favourably with when you think about the complications of measles. So, if 100 kids get measles, about 15 of those kids are going to get quite serious complications, and maybe 1 in 1,000 is going to get very, very serious complications. I would direct you to, if you're seriously thinking, oh, maybe I don't want to vaccinate my child, I would seriously direct you to the National Centre for Immunisation Decision Aid. I'll put the website here, which has got some very nice tables where you can balance the risk of having the vaccine versus the risk of getting the disease. We are seeing outbreaks happen in the community. It's not a theoretical risk, and I really recommend you to speak to your doctor if you've got any concerns about the measles vaccine. So that's a bit of a whistle-stop tour of some of the issues. I hope that provides you with some general perspective, and I wish you well from Family Doctor.Expert.